each module has a workbook. These workbooks are very slim and only take 10 or 15 minutes to read. They give you a little bit of background on the module, and then they talk you through the aims of the module that you need to look at. How you complete these aims is completely up to you, but we've got some suggestions here of things that people commonly do. So first of all, you can use relevant core foundation teaching towards Enhance. A good example here might be teaching from the care of the elderly team about frailty or polypharmacy, and that would fit really well with the complex multimorbidity module. You can also use non-core teaching, so maybe e-learning from the internet or teaching on your ward or even from a conference. Next of all, you can use reflection on clinical events. So as you know, you're already expected to do a lot of reflection during foundation. You can just steer some of these towards some of the themes in Enhance. Next of all, you could do shadowing other health or social care professionals. So you're not expected to take a whole day off or take study leave to do this. It might just be following them around 1 or 2 patients on your ward that you already know and have an interest in their care. Next of all, there's engaging with lived patient experience. So you can do this directly with patients on your ward. There may be someone that you've built a good relationship with that you could talk to about their experiences and what they've been through whilst they've been in hospital. We also totally appreciate that sometimes this isn't possible. So you can also do lots of things like reading about patient experiences or watching videos on YouTube or the internet. Finally, there's also the opportunity to do slightly more unusual things. And lots of people have done arts-based practice in Enhance. So that might be reading poetry or memoirs by people that have got chronic illness, or it might even be making some works yourself. It doesn't matter what you do, as long as it goes towards the aims of the module. So although you can do whatever you want to complete an Enhance module, you do need to make sure that you do one of these essential elements. The first one is a case-based discussion, exactly the same as you do for another area of the curriculum. It's just got to have an Enhance focus. There's also the option to do a reflection on a clinical experience. Again, just make sure that it aligns with the Enhance module that you're doing. You can also engage with lived experience. Like we said earlier, that can either be talking to one of your patients directly and writing about that, or it could be engaging with a video or a memoir and then reflecting on a specific element of that. You can also shadow or work alongside a member of the MDT, and there's no specification as to who that needs to be or what work you need to do. Finally, you could take part in a QI project. Now, this could be one that you do on your own and have thought up yourself, or it could be a larger quality improvement project or audit that your ward is doing that you decide to pick a particular element of and make it relevant to Enhance.